This is the Investor Connect podcast program. I'm HealthE Martin. I'm the host of the show in which we interview angel investors, venture capital, family offices, private equity, and many other investors for early stage and growth companies. I hope you enjoy this episode. Investor Connect is a 501c3 nonprofit dedicated to the education of investors and startups for fundraising. Please consider donating $100 to the program to help others in their investor and entrepreneur journey. You can find the donate button on the investorconnect.org website. Well, hello, this is Hall Martin with Investor Connect. Today I'm here with Jeremy Miller, chairman and founder of HealthE Commerce. HealthE Commerce is the parent brand of a portfolio of brands that consists of its brand FSA Store, HSA Store, WellDeserved Health, and Curing Mill. HealthE Commerce's mission is to make it simple and convenient for the 35 million U.S. consumers with pre-tax accounts to use them confidently. Jeremy, thank you for joining us.
Thanks for having me.
Great. So tell us more about your background before founding HealthE Commerce.
Sure. My background before founding HealthE Commerce, I was working for a lot of small businesses, startup companies, helping them grow. My last official job I was working for an architect, building out a whole technology platform for 3D architectural rendering. So a little bit of tech, a little bit of healthcare, a little bit of HR, a little bit of everything, actually. So I wore a lot of hats in different jobs, and that really helped me propel to start the business.
Great. So what led you to start work in this space to begin with?
Yeah, so I kind of fell into it. I went to business school in 2009, 2010, and knew that I wanted to try to find a business to start. And my last role where I was working wearing those hats, I came across these accounts called flexible spending accounts and health savings accounts. Never really knew what they were. Seemed really interesting, and kind of just stumbled upon it. And they sounded to be kind of pretty niche accounts. People not really knowing what they were, not like a big population of people having them. And then when we started digging a little more, just saw how big of a market this was and how many people, millions of people that actually use these accounts every day.
Great. So what's your advice for people investing in this space? What do you tell them to do before they write that check?
Well, if they found the space, they've already done a good job, because it's not a big space in terms of being out there. Like you see digital health companies and you see these large service providers and this whole ecosystem of healthcare. FSAs, fall into the kind of consumer directed healthcare accounts. When we launched the company back in 2010, there was maybe 6 million HSA accounts and maybe around 10 million FSA accounts. Today, 10 years later, there's almost 25 million FSA accounts and well over 30 to 35 million HSA accounts. So the growth of this industry has just been spectacular. And so if you're looking at it, and you know something about it, you've already come a long way. But I think that there's a lot of companies that you see that are really starting to enter the space, or at least try to market into these accounts as well.
So let's talk about the state of investing in this sector. How do you see it evolving from here? Where's it going?
Yeah, so when we launched in 2010, I could count maybe on my hand how many investments were made in this space. And now seeing a lot of companies really evolve, starting to provide new services for HSAs specifically as those accounts have grown. You see new providers kind of entering the market space. So there's a lot of activity, but it's still relatively unknown to the most of the world. Even though if you ask someone, the odds that they have an FSA or HSA are kind of like 1 in 4. And if you look at people who have access to even just an FSA, it's a huge there's a huge gap into how many people have access to these accounts that just don't use them. They don't take advantage of the tax benefits of these accounts. So for investors looking in the space, it's just great to see that there's starting to be companies that involve and start to provide real services into these kind of complex healthcare accounts.
Great. And so what is the growth rate of this sector?
Yeah, so I think the biggest one is in HSAs, health savings accounts. So there's those, if you have an HSA, you put aside, up to $6,000 as a family, tax-free into your high deductible healthcare account. You're saving a good amount of money. The growth that you see in those accounts has just been astounding, from 6 million to well over 20 million. And if you look at the number, right, if you look at the dollars that are being spent, on FSAs, for example, $24 billion a year is spent each year out of these accounts. So $8 billion just on prescription copays. And so you're like, oh, these just seem like a niche kind of, account. And then when you actually look at it, you're like, whoa, 8 billion alone in copays. And that just makes it part of the pie, medical services, products like we offer, glasses, contacts, all those type of products that people use every day, they're getting tax-free.
Great. Well, you mentioned a moment ago that didn't used to be very many people working in this space. How many companies do you think are engaged in it today?
We did an analysis, actually. We looked into companies. I'd probably say well over 150 companies that kind of touch something that we do now. Everything, there's just a gamut of providers and companies and startups and everything from better tools to manage your account to, really manage your balance, all the way to, medical services transparency tools that allow people to really shop around for their medical services and see, how they can save some money, right? Because these accounts are really meant to, help people save on their healthcare dollars so they can stretch those dollars farther. And so there's a lot of companies that are really kind of proving out that they're doing that. And it's been really excited to see them come along.
And so what were some of the challenges in starting a business in this space? What did you encounter?
Yeah, I think there's definitely a gap in knowledge. And I think that we found one investor who had invested in the 80s in a very early stage, kind of like FSA company. And when he saw our company, he was like, wow, this is another company that's done well in the space. They don't really come around that often. He was quoting something from the 80s. And just to answer your question kind of more clearly, are you asking about more like the accounts or the investments?
More the accounts, and is there any regulatory that is a challenge here? A lot of these things have regulatory attached to it, and I wasn't clear on what the regulatory is here.
Yeah, we operate in a highly regulated market, and we also are dealing with accounts that are coming from they're government sponsored, right? So the majority of the savings is due to tax savings. So we've been since day one, we've been really focused on really kind of looking at regulation, really focused on compliance. Compliance is a huge aspect of our business. Like everything we do touches either a service provider or an administrator, and we have to make sure that we're highly compliant or in regulation for all kind of healthcare codes. We have to make sure that we focus on HIPAA and high tech and all of the kind of privacy issues that healthcare accounts have. And so we've done that since day one. We've really focused on making that a priority. Back 10 years ago, when we did see startups that, it was kind of like, oh, let's just enter the space. We'll provide a nice tool for people to use. And like, well, have you thought about, these privacy laws, or have you thought about this regulation? So, we were since the beginning very focused on that.
So you touched on privacy, and there's also, data management laws there. How are those changing in your space? What are you seeing on that front?
I just think, as I think the biggest changes are occurring is that technology is evolving rapidly, and you have to kind of also be in a highly compliant environment. And so the challenge we face is when we're looking at new offerings, we're looking at new technology, how do we also build out that technology to make it highly compliant? And, some of the providers out there, we kind of have to push a little and say, hey, these are the regulations that we're seeing now, right? And how can we build a tool? And do you have the capabilities or not to be able to build a tool that's as compliant and regulatory as we need? And I think that's we just did a major tech overhaul, and we were able to accomplish that. And it took some steps, but we were able to do it.
Let's talk more about HealthE Commerce and how do you fit in the overall industry landscape? Are you the premium provider? Or are you the low-cost provider? Where exactly do you fit into the landscape, and what exactly do you offer?
Sure. So our brand, I mean, is very simple, and it's actually that's the brand, is that we make it simple. And so, as we've talked about a little bit about the complexity of these accounts, the regulation, and all the things we have to focus on, we take care of that for the consumer. And so there's no need for the consumer to, for example, submit receipts, to adjudicate their claims. There's no need for the consumer to wonder if this purchase that I make on the site, is it going to be covered by my account? Are they going to reject it? I'm going to have to, go through the hoops to try to get something done. And so we've taken all the guesswork out of it, and we made it really, really simple for people to utilize their accounts. And I think that's why they come to us every time. And, there is a time component to these accounts. FSAs expire after 12 months to 16 months. And so there's also kind of a time where people need to spend their funds, where they have extra funds, where their funds are at risk of actually expiring. And so, when they're rushing, usually it's around December 31st to make their purchases. We have to be there. We have to offer what they need. We have to have the customer support that they need. We have to have the products that they want. We have to be able to take the card that they are using and make sure that the card hits in the right date so they're not losing their funds. And so there's so many components that add up to, this healthcare tool that we provided, and making sure that it meets the needs of the consumer. And we've, been focused on that since day one and have continued to execute on making that better each year.
Great. And what do you have coming up in the near future?
So we launched our Medicare site last year, which is really interesting. Medicare Advantage is a new, kind of new industry where people can utilize their Medicare dollars on over-the-counter products. And so we offer over 5,000 products for people that want to use their Medicare accounts. Again, the government and providers provide this money, sometimes up to $85 a month, free to spend on products that they need, that people need. And so we launched a site. We're looking to really focus on getting some nice partners in that space. There's a huge B2B component to our business, and it's the same there. And so we've launched that. Also excited about our wellness site, WellDeserved. As companies are starting to provide more wellness dollars for people, we meet the needs of really providing tax-free wellness. So if you were to create sometimes in companies, people have to, or are incentivized to provide a healthcare report or healthcare questionnaire, and people get money, right? And that money can be now tax-free. So you can go onto our site, you can use that healthcare dollars to spend tax-free. So you're saving 40% on the dollar on things you would normally buy and have to pay tax on.
Great. Well, in the last few minutes that we have here, what else should we cover that we haven't?
Well, you have a mix of investors that listen in, and you also have a mix of startups. I think something interesting around our business, and hopefully people can emulate too, is just the fundraising kind of sphere that we operated in 2010, and just if there's and the kind of what I like to look back on is our fundraising process, and kind of doing a lot with a little. And you don't hear that as much now, but I guess for investors looking in the space, and for startups that are looking to expand, I mean, you can still do a lot with a little. I'm sure you can do a lot with a lot, and we've seen companies do not a lot with a ton. So there's definitely a spectrum there. But in terms of just fundraising, if there's being in an industry that's kind of niche and looking at a market that all of a sudden became really big, we had a pretty interesting course of fundraising.
Great. Do you see the regulatory changing in the near future, limiting this, or do you think it will continue as is?
We've seen expansion. When the CARES Act came out in March, April of 2020, they provided a lot of products that all of a sudden became eligible under these plans: feminine care products, over-the-counter medicines. And so we've really seen an expansion there, and we continue to push on different products to see covered, the expansion of limits and amount of money that people can put aside, how those funds expire. We've just really started to work closely with our head of compliance and with kind of anyone that kind of advocates on our behalf on really making sure that these accounts grow, that people use them, that they take advantage of them, and really kind of come out ahead with saving on their healthcare.
Great. Well, how best for listeners to get back in touch with you?
I'm on LinkedIn. J Miller CBS 2010. Happy to kind of engage on LinkedIn if you directly email me or text me, or sorry, not text me, email me or ping me on LinkedIn. I don't even know what it's called on LinkedIn. Is it just a DM?
I think we used to say connect with me on LinkedIn, but
connect with me on LinkedIn. There we go.
I think that's the main thing you can do there. But you can also message. You can message on LinkedIn too after you connect. So sound like that's the best way.
Right.
We'll put that in the show notes. We want to thank you for joining us today and hope to have you back for a follow-up soon.
Thanks. Appreciate it. Thanks all.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. HealthE Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.